History matters because it helps us to avoid two huge but frequent mistakes. The first of these is the assumption that in a rapidly changing world, what's happened in the past doesn't matter. It's a kind of year zero mentality. There's a view really from every government when it comes in that what it's doing is different. We're starting afresh. This is going to be a big reform. And because it's a big reform, it doesn't really relate to what's gone on before. And I believe that's fundamentally wrong and fundamentally flawed. The continuities with the past, as well as the differences with the past, need to be understood by policymakers if we're going to make good policies for older people. The second big mistake is there's often a myth of a golden age around. There was a wonderful time for older people when everybody had dignified care, there were lots of services around. Because many commentators, and perhaps particularly academic commentators, feel uncomfortable with a lot of policy directions, there is a risk that they talk about a time when things were much better, when care was always dignified, when services were fairly plentiful, when older people were very satisfied with what they were getting. And I think we need to look at that more carefully. There certainly was good practice going on, but there were also considerable problems and considerable difficulties. And I'm looking forward to illustrating some of these in a few moments. I think a good way to illustrate the importance of history is to take an example like the present debate around dignity in care. It's very high profile at the moment, and a lot of it concerns either older people or other adults who are vulnerable, receiving very poor care in various types of institution, whether that's an assessment centre, a care home, or a hospital. However, if you do look back on the past, the last 60 years or so, what you do find is lots and lots of examples of very similar situations being exposed. If I go right back towards the end of the Second World War, the government commissioned a series of surveys to look at public assistance institutions and the quality of what would be going into the National Health Service and into local authority care homes. What they discovered was what one of the reports called the reproach of the masses of undiagnosed cases. What they found was young people, unmarried mothers, lots of older people with mental health problems such as various dementias, as well as lots of older people with very severe health problems, chronic health problems, all, as they put it, banded together with very little treatment going on, very little strategy for supporting them, and they considered this to be an absolute national disgrace. The outcome of the surveys, of course, was the creation of a National Health Service in 1946, which was meant to provide free care for older people with health problems. And in 1948, a new system of care homes for older people was established to be run by local authorities. The new care homes were very interesting because Aneurin Bevan, as Minister of Health, talked about them as being sunshine hotels or eventide homes. There was very much a view that these were going to be very positive places that older people would choose and want to be in which all the old attitudes of the poor law would be swept away. If we switch our clock on about 10 years, we can come across Peter Townsend's classic study of local authority residential care. It was called The Last Refuge, and it was published in 1964. What Peter found was extremely disappointing practice. Many of the old institutions, poor law institutions, buildings were still being used. There'd been very little training of staff had occurred, so very patronising, demeaning attitudes towards older people were very common. There were few attempts made to engage older people in positive activities, and he even found a minority of staff who were really continuing the old harsh poor law attitudes. So what he found was something very different to the original conceptualisation of a hotel, and something that had really not moved us on a great deal from what had gone on before the Second World War. I think an example like this alerts us to a really important series of insights of relevant to today. For me, it really underlines the depth of ageism in our society, and as a result of that, the extent to which older people and other vulnerable adults are so at risk in institutions if there isn't a real commitment to quality and good inspection systems around. I fear the other lesson it has is that so often the media and the public become very concerned about these issues, as they did at the time of the Ely Hospital scandals. In 1969, the House of Commons was presented with a report of a committee of inquiry into allegations of ill treatment of patients and other irregularities at the Ely Hospital, Cardiff. This hospital was a large facility for adults with severe learning disabilities and also adults with severe mental health problems. In fact, the biggest group of patients there were what at the time were called psychogeriatric patients. And these older people, many of whom had dementia, had extremely worrying experiences at this hospital. But attention is very short term and it drifts very quickly. We find another moral panic to worry about, and as a result of that, so often the old problems reoccur and people drift back to poor practice. So one has to really hope that this isn't going to happen at the present time with the huge attention being paid to some of these issues. There are many other examples that can be found where I think this long view helps us understand, have a deeper insight into some of the issues we're grappling with. Another one I would choose would be relate to the government's present high-profile emphasis upon the need for communities to take a much greater responsibility to look after themselves. Norman Lamb, the health minister in the present coalition government, very recently got a lot of publicity for talking about a potential role for neighbourhood watch services to move away from being concerned primarily with houses and burglary to a much more all-encompassing engagement with potentially isolated older people and then becoming much more civically engaged with providing an enormous amount of support for them. The context, of course, of this is the fact that within an ageing population and at a time of what is deemed to be a time of austerity, the view is that the state is increasingly only going to be able to focus on those in absolute crisis point, and therefore there's a need to draw upon voluntary effort much more than in the recent past. One of the things that strikes me about all of this is how rarely is there any referring back to previous times when such a high emphasis was placed upon voluntary effort. In the Second War settlement that saw the NHS created and social care provision brought in, the role of local authorities was actually very prescribed indeed. They were very restricted in terms of the services they could provide, and they had no general power to promote the welfare of older people. Instead, it was very much believed that that role should be carried out by volunteers and by voluntary organisations, with paid officials in such voluntary organisations having a role in trying to organise volunteer effort. Meals on Wheels, a lot of day centres, luncheon clubs, befriending services were all delivered through those kinds of mechanisms in the 50s and 60s. By the late 1960s, research evidence was building up that this set of arrangements really was not working for at least two main reasons. The first of this related to the fact that evidence was clearly emerging about uneven provision, frequently not linked to need. There was a big study of Meals on Wheels services that was carried out, and this identified things such as the fact that many of the Meals on Wheels services were being cooked and produced at schools. Of course, sadly, what happens over the summer is that the school closes down, and though that's great news for the children, it was less good news for older people dependent upon the Meals on Wheels, who were having to wait 6 weeks before the service was reinstigated. So it's felt that it wasn't a sufficiently professional service being delivered. The other evidence that began to emerge was that some communities had more internal resources, what we'd now call social capital, to draw upon to support them to develop things like day centres, luncheon clubs and befriending services. And as a result of that, again, inequalities were beginning to emerge in the availability of services. I think there's real potential for new areas of inequality to emerge, that some areas may well be able to look after themselves, others may struggle with more difficulty. I live in a fairly affluent village on the outskirts of an affluent city. We have a wonderfully successful community shop. People helping it include an ex-accountant, lawyer, people involved in retail. It has a huge turnover. It's reinvesting money back into services into the local village. We're very lucky, but one can envisage many other communities where it's going to be very difficult to achieve anything equivalent. And that may become even more clear if we begin to move towards more personal care and the willingness of neighbours to do that. And finally, it makes me realise that it's crucial that if we are going to go down this road, and there appears to be almost cross-party consensus around it, we have to invest in infrastructures in poorer neighbourhoods to help volunteer effort be organised to support these things to happen. If not, as I said, the outcome is going to be inevitable increased inequality. It can be seen from what I've said already that I'm a great enthusiast for taking a long view, but I do have to acknowledge there are some pitfalls in trying to do this. Personally, I was not trained as a historian in historical research methods, so I always need to take cognizance of what historians tell us relate to good practice. It's important to draw upon multiple sources. It's important that we realise both documents and oral histories are at one level social constructions of what may have happened. They're not absolutely the facts of what happened. Evidence is often fragmentary, and it's important to try and to work to deduce your interpretations from the evidence rather than start from a preset hypothesis you're trying to prove or disprove. So if I was to criticise myself, there's a danger that in my enthusiasm to criticise the myth of the golden age, I create my own myth of the miserable age, that I make everything look bad, worse than it really was. So it's important to provide a balanced view of both the important things that occurred in the past, the good practice, as well as the more problematic practice, and try and take a balanced view from that. I'd like to finish really on a few thoughts, a very few thoughts about the importance of this approach. The quotation I always remember and draw upon is from the historian Anne Digby. She made the really insightful point that history does not repeat itself precisely. However, what she argues, and what I fully support and agree with, is that certain issues, certain tensions, certain pressures do keep reoccurring. And unless we learn from those and look at those from the past, we condemn ourselves to remake history without being informed by that. If we think about older people, issues like the role of the family, how much services should be charged for, how do we ensure quality, how do we get health and social care working effectively together? These are all the issues of today. They've been the issues of the last 70 years. And if we don't look at that and learn from that, then we're going to do a disservice, I believe, to the older people of the future.